Hello, everyone, and thank you for joining us today as our virtual reality naloxone training webinar gets underway. We're thrilled to partner with CADCA and Walmart to present this unique experience. CADCA launched this simulation in February of 2020 and their National Leadership Forum. Since then, they've held more than 25 virtual screenings and engaged thousands of participants. We look forward to seeing this initiative reach countless more communities. Today, we'll hear from a wonderful group of speakers here in Florida who are working every day to save lives. Then we'll view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Our goal is to learn how to use this technology to help community leaders like you save lives and create a norm that every life is worth saving. Now, I'm pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined CADCA in 2021 and has been working ever since to help further their mission of building and maintaining safe, healthy, and substance-free communities. We're thrilled to have him with us here today. Valentino?
Hello, everyone. I'm thrilled to be here. First, I want to extend my gratitude to Walmart for their commitment to saving lives through this innovative training. For some of you, this will be your first time using a VR headset. If so, I encourage you to embrace the experience and the training that comes with it. And yes, your head will be moving around. I'd also like to thank our friends and supporters at the Gang Alternative and Urban Partnership Drug-Free Community Coalition. It's an honor to be along such remarkable leaders from around Miami and the great state of Florida. CAC has a footprint in over 30 countries and more than 7,000 coalitions across the United States. We work with community residents and leaders to develop coalitions and reduce substance misuse by adapting CACA's model for community change. CACA knows that prevention is the most cost-effective way to reduce substance use and misuse. The emphasis on prevention is more crucial than ever before. The CDC reported that there were over 107,000 fatal drug overdoses in the United States in 2023. So let's put this in perspective. That would be like the Miami Marlins and the Miami Dolphins both selling every seat at a home game at the same time. This is why leaders and community stakeholders like yourselves are crucial. You are really the true heroes in driving positive change. Our partners at the Drug Enforcement Administration continue their One Pill Can Kill campaign, which has raised awareness about fentanyl-laced pills that are killing so many fellow Americans. In 2023, the DEA seized more than 80 million fentanyl-laced fake pills and nearly 12,000 pounds of fentanyl powder. The 2023 seizures are equivalent to more than 381 million lethal doses of fentanyl, more than enough to kill every American. Their message could not be clear. The only safe medication are the ones prescribed by a trusted medical professional and dispensed by a licensed pharmacist. A DEA administrator, Ann Milgram, shared at CACA's 2023 National Leadership Forum, "This is not a war on drugs, but a fight to save lives." We also need to be vigilant in trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine, or also known as tranq, as a key emerging threat and has been identified in all 50 states. It interacts with opioids in a devastating way that leads to overdoses. In a report to the White House, the Office of National Drug Control Policy stated that community-based programs will be amongst the first to interact with individuals vulnerable to fentanyl contaminated with xylazine. In the current landscape, we need every available tool to save lives and help our communities recover from the drug crisis. This gathering today and the Walmart-sponsored innovative training is a huge step forward. Keep up the good work. I look forward to seeing you in person soon. Back to you, Jeff.
Thank you for joining us today, Valentino, and for all your leadership across CADCA in this work. Turning to our wonderful group of speakers from Florida, we're happy to introduce to you Dr. Wendy Stefan, the educator and epidemiologist for the Florida Poison Information Center in Miami. For the past 17 years, she has promoted the use of poison control and worked to prevent poisonings of all kinds, including from medications, household chemicals, and environmental hazards. Dr. Stefan completed her PhD in epidemiology and her Master's of Public Health degree at the University of Miami and currently serves on the board of directors of American Poison Centers. Dr. Stefan, we're looking forward to hearing from you.
Hello, I'm Wendy Stefan, educator and epidemiologist at the Poison Control Center in South Florida. We often get calls about people who've experienced an opioid overdose or who suspect they may have encountered a situation involving opioids. The Poison Control Centers can be a great resource when you're trying to decide how to handle a situation you think may be an opioid overdose. So, for instance, if someone has taken the wrong medicine, say a child has gotten into somebody's stash at home or into their pills, and the person still seems fine, this is a great time to quickly call the Poison Center and get some information about, what was taken, when did it happen, what symptoms the person might be experiencing. That being said, if the person is already struggling to breathe or is not breathing, then the call should be to 911. They typically will bring in poison centers as needed if they need help managing a poisoning of any type. But our emergency services are very comfortable using naloxone and have used it clinically for about 40 years. So we're there to help as needed. You can also call us with questions. So, for instance, sometimes someone may suspect an opioid overdose, but what if they're seeing symptoms that aren't consistent with that? So, you can call the Poison Control Centers, explain what you're seeing, what might have happened, what the person had access to, because that might give you a little more information about how to proceed. Calls to Poison Control Centers are free and confidential, and they're available 24 hours, 7 days a week. We're there to assist. Our doctors, nurses, and pharmacists have extensive training and are the same people that the doctors treating poison patients call. So you're getting a very high level of expertise, and again, totally free. When we think about preventing poisonings, we talk about securing medications in the home. Certainly with toddlers, maybe all you need is to put things up and away and use a cabinet lock. But of course, now we think about the safety of our teens, our loved ones, our adults in the family, our older adults that we might be caring for. So now we recommend a little bit more. So a medicine safe might be what's appropriate for you. Maybe it has metal sides, maybe it fits in a drawer. There are a lot of different options now, but we do want to now secure medications for the whole family to prevent overdose of all types. Poison centers are excited to work with our community partners in injury prevention and in the area of drug abuse prevention. We fill an important niche in sort of emergency response, right? We'd like to prevent poisonings, and we have staff that can respond to poisonings in the hospitals, but we're the folks there that you can call right in that moment when you have to decide what to do, right? Something unusual has happened. Is it serious? Is it not serious? The Poison Control Centers can help you with that question. Right now, we really want to make sure we're not only talking to people before they encounter an opioid, right, or young people, but also to work with folks who are already exposed or at risk in some way. So that might be somebody who has, developed over time a dependency or opioid use disorder. But it also might mean someone who's using opioids to treat pain or using a medication to help them manage their opioid overdose risk. So, for instance, a medication-assisted therapy. We do consider naloxone a very important part of saving lives from opioid overdose. Our Poison Center partners with South Florida Opioid Alliance to actually provide free naloxone to different agencies in the community and direct to the public at different events. When I look at recent trends in opioid calls to the Poison Control Center, we certainly see a lot of calls about oxycodone. That's something that people know to call Poison Center for when there's been a mistake with medication. We do see fewer calls about illicit fentanyl just because people may not think about the Poison Control Center for a street drug exposure, but we certainly do assist with that type of call. We also help our emergency providers. So we talk to doctors, nurses, pharmacists who are treating poisoned patients, in addition to helping members of the public. We encourage everyone to save the number for the poison helpline into their phone so that they have it just in case. Of course, people do Google it, but what if you don't have internet access in that moment? So we encourage you to save the number 1-800-222-1222.
Thank you, Dr. Stefan, for helping all our neighbors be more aware of how they can stay safe from unintended harm, and for making sure we all know what to do in that moment when we may need to call poison control. We appreciate your work so much. We now turn to Gang Alternative's own Alishka Vigil, the program manager for many of our key opioid and violence prevention initiatives. Alishka is a dedicated social worker with a bachelor's degree in criminal justice from the University of Central Florida. She has committed her career to supporting youth and families facing complex challenges. Alishka began her career focusing on the youth who are affected by mental health issues. Her work involved providing support, navigating the juvenile justice system and foster care systems, and delivering educational resources to help those families overcome obstacles. As a program manager at Gang Alternative, Alishka plays a pivotal role in overseeing and managing the organization's key initiatives. Her responsibilities include leading the opioid prevention programs with the community where she grew up, focusing on prevention, intervention, and treatment services for families affected by the opioid crisis. Additionally, she manages the Not in Our School program aimed at preventing violence in Miami-Dade County Public Schools. This involves implementing evidence-based curricula, making referrals to appropriate services, and providing youth mental health first aid training to educators and other professionals. Having navigated similar challenges during her youth, Alishka understands the critical role that organizations like Gang Alternative play in providing hope and effective support in those facing similar difficulties. Take it away, Alishka.
Hello, good morning. My name is Alishka Vigil, and I am a program manager here at Gang Alternative. And I just wanted to briefly go over what we are seeing in the community and the state of the opioid issue here in Homestead. So as a provider in Homestead, we're seeing the opioid crisis continue to affect our community significantly. The issue has actually evolved and is on the rise now with the synthetic opioids like fentanyl, which is of course more potent and deadly. And as someone who works closely with middle school students, I have observed that the opioid crisis impacts them more indirectly. Meaning that many of these young people are affected by family members struggling with addiction or by seeing drug use in their neighborhoods. And we know that, of course, that this exposure can lead to emotional and behavioral challenges, making it very, very crucial for us to address these issues early on and making sure that we provide the necessary support to help them. So because of this, there has actually been a push towards preventative measures such as education on drug abuse in schools and community programs aimed at early intervention. Which brings me to, well, what is our program doing to combat the issue? Our program takes a comprehensive approach to addressing the opioid crisis, especially focusing on middle school students and their families here in Homestead. We start with prevention by offering evidence-based programs in schools that teach life skills and healthy decision-making. And during the summer, we keep the momentum going with community sessions that help reinforce what the kids learn during the school years. For those already impacted by the opioid use, we provide a full range of support, including case management, support groups, mentoring, and even therapy. We have therapists on staff who specialize in substance abuse counseling, and they work closely with students and their families to help them understand the underlying cause of addiction, how to manage stress, and develop healthy coping strategies. If more intensive treatment is needed, we have partnership with local facilities that can provide residential treatment. We also place a big emphasis on involving parents. We hold monthly parent circle sessions where parents can come together, discuss what's going on, and share ideas on how to support their kids. Plus, through our work with local coalitions such as the Urban Partnership Drug-Free Community Coalition and Urban Partnership for Success Collaborative, we're making sure that the community is informed, educated, and aware of the issues impacting their communities. So what can community members do to help combat the opioid issue? Community members can play a vital role in combating the opioid crisis. First, get informed, right? Attend town halls, join awareness campaigns, and stay educated about the dangers of opioids. Open communication is also key. Encourage honest conversations about drug use in your family and community, and support those who may be struggling. It is very important that we reduce the stigma around seeking help, and that can make all the difference. Volunteering is also very, very crucial. So mentor youth, participate in prevention programs, or support local organizations focused on substance abuse. Lastly, advocate for better resources and services like access to treatment and stronger community support. You know, by coming together, we can create a safer, healthier environment for everyone, especially our youth. And come and join our coalitions. If you want to get more information on how to be part of our coalition, visit our website at myga.org, and you'll get all the information on there. Thank you.
Thank you, Alishka. We're so lucky to have you on our team and appreciate all you give to the youth of our community. Our next speaker, Thomas Guerrera, is the founder, president, and CEO of Fentanyl, which works every day to decrease the risk of substance use through harm reduction and recovery support to individuals right here in South Florida. Thomas Guerrera is a person living in long-term recovery since 2014. He graduated from Florida International University with a master's degree in mental health counseling and previously received his bachelor's degree in psychology from FIU in 2015. During his time as a graduate student, he founded Panthers for Recovery, a student organization dedicated to helping students in recovery. From 2018 to 2021, Thomas worked as a therapist at a South Miami recovery facility, and he founded the Miami Recovery Project in 2020, one of Miami's first recovery community organizations. In 2023, he founded Fentanyl out of necessity in fighting overdose crisis. Thomas's favorite accomplishment is being a father to his kids, Anthony and Annabella. His personal recovery has allowed him to be present for his family and help others do the same. Tommy, please take it away.
Hey everybody, my name is Thomas Guerra and I am with Fentanyl. Thank you for having me. It's a pleasure to be here. I'm going to get right into what we do. Fentanyl, we're a nonprofit organization that focuses on harm reduction and recovery support, but our main mission is harm reduction, so we can ensure people that can be safe and ultimately save lives. And we do this in a number of ways. We provide harm reduction supplies to the community, which includes Narcan, test strips, and then we do street outreach in the community, which would include going out into areas where people are experiencing homelessness, and providing hygiene products and harm reduction products, and doing trainings where we can actually talk to the communities and teach them how to respond to an overdose, and hopefully break some stigma attached to people that use drugs or people that are in recovery. And then last but not least, we provide resource linkage. So what we don't do, we can link people to that, which includes detox or treatment, whether they have insurance or no insurance. So those are the main things that we provide at Fentanyl. But the reason we're here is because we're losing people at an alarming rate. And on this next slide that I'm showing, there's about 10 people on this slide that I knew directly. There's another about 5 other people that I know their families. And the majority of these people did not intentionally want to take fentanyl. What happened was that they took another substance that was laced with fentanyl. And so unknowingly, they took fentanyl and led to their passing, which is less of an overdose and more of a poison, right? Because they were not intentionally trying to use this substance. And that's why we're here. We want to educate. We want to let people know the realities of what's going on with the substances that are out there. It's not like it used to be, where people hit their rock bottom and then they're gonna pass away. It's people trying for the first time or experimenting, um, and they're passing away. On this next slide, it's kind of just a demonstration of what we're up against. It's we have photos of a fake substance versus the real, and they're designed to look exactly the same. Whether it's supposed to be a prescription drug, the fake ones are pressed on the street with pill presses, and they're designed to look exactly the same as a prescription pill. Even lacing with substances like cocaine, which is not necessarily, it's not even the same class as an opioid, which what fentanyl is. They're lacing that as well. And the only way to really know what you're getting is if you're going to a pharmacy to get that. And most people that are using these substances um, uh, may not be getting it at a pharmacy. So despite the fact that you may have trust in the person you're getting it from, whether it's a family member or a friend or somebody that you really trust, um, 9 times out of 10, it is laced with other substances in it, which may likely be fentanyl, right? Um, and the only way to really test for what is really in it is to send it to a lab. But most of us don't have access to a lab to kind of test that. So the next best thing is to use fentanyl test strips, which is a tool available that can test for the presence of fentanyl in pretty much any substance. And then you can make a decision after that, at least knowing what's in the substance. When it comes to the numbers, particularly in Florida, we're pretty up there. As you can see on this slide, it's almost 8,000 in the year of 2022. 2023 looks about the same. As a nation, we're upwards in 107,000 overdose deaths. That's the highest in the history of the United States, right? And it's the number 1 killer of 18 to 45-year-olds for accidental death. That's more than gunshots, and that's more than car crashes, right? So it's up there. It should be on everybody's radar, whether you believe that it's drug use or substance use is affecting you or not. It's gonna be around, right? It's affecting everybody, so it should be on your radar. So how do we, address this epidemic that's happening? There's a number of different ways, but harm reduction is huge, right? It's something that we know that people are gonna use drugs. Not everybody's gonna stop at the same time. Not everybody's gonna, listen the first time to don't do drugs. So if somebody is gonna use, we want them to at least be safe if they're gonna do that. The main tool we have is Narcan or Naloxone, which is a nasal spray that's used to reverse an overdose. And it's basically a miracle drug that can bring somebody back to life that is experiencing an overdose. And we're able to provide that for you. We do that free of cost here at Fentanyl, but in the state of Florida, there's upwards of 400 providers that can do that as well. Fentanyl test strips, again, you can test for the presence of fentanyl in any type of substance. And then practicing safe use practices, which includes never use alone, includes always carry Narcan, includes always call 911, right? These are simple, common sense things, but we're not so common when we're in this situation. So just to remember those types of things. Taking a training, we provide trainings, numerous trainings a month, including overdose prevention training. Highly recommend taking a training in your local area. And they'll probably be able to give you Narcan, but also give you teach you how to use it as well. And there's a lot of background information that can help with that as well. So that's always being held from us, but other organizations hold that on a regular. Outreach, meeting people where they're at, going out into the community and talking with them. What do you need? How can we help you? That's what we do on the regular, whether it's going to an area where there's a lot of people experiencing homelessness, or going to a music festival, right? These are different populations, but we're going there for the same reason, so we can teach people to be safe and provide them the tools that they can to be safe. And we're out there in the community, and that's where we have the most effect, and that's where we're actually saving lives. You can look at the next slide with some of the stats. We've been a nonprofit for a little over a year, and we've been able to provide numerous trainings. But the biggest number there on there is the lives saved, right, which is reported reversals, which is we have 70 reported. I 100% believe that there's more than that, but that's the only ones that we've got wind of that were reported to us. And so that's the goal. The whole goal is to save lives, to live another day. Somebody that passes away cannot find recovery. So our main goal is to save their lives. If you would like any more information, you can reach out to me. On the slide has my email, phone number, our website, and then the QR code. You can scan that and see all our resources, which includes the how-to videos and our upcoming events. So please check that out, and thank you for having me, and take care.
Thank you, Tommy. You're such an amazing partner to us at the Coalition, and we appreciate all your work getting out there and making an immediate change in so many people's lives. You really are the hope and change we need to see in Greater Miami. Next up, we have Amelia Martinez, manager of Safe Syringe Exchange Services, the only syringe service program approved by the Broward Commission under the Infectious Disease Elimination Act, the Special Purpose Outreach Team, or simply the SPOT. Emily oversees the total operation of the SPOT and serves as its community liaison. She previously worked as the mobile outreach and remote supervisor of the Idea Exchange in Miami. And as an outreach supervisor, she is the liaison between the Idea Exchange and the community. Motivated by the death of many of her close friends from HIV and AIDS, she strives to save as many people as she can, one person at a time. Since 1992, Emmy has worked with vulnerable populations, especially those at risk for HIV and HCV. Her experience spans working with Care Resource, formerly known as Health Crisis Network, National Latino, a lesbian and gay organization in Washington, D.C., Union Positiva in Miami, Miami-Dade County Health Department, and the University of Miami. 29 years later, her passion and drive for her work as a harm reductionist brings her back to where it all began, Care Resource, where she will continue her work as an advocate for the community through compassion and tolerance. Now, here's Emmy.
I want to talk to you a little bit about Narcan and harm reduction. Right now, we're having a bit of an epidemic when it comes to young people overdosing, especially with pills. We have an issue where a lot of the pills that are coming in that are being bought online are laced with fentanyl. People think that they might be buying Adderall or Percocet or Xanax bars or Zany bars, right, like they call them, or oxycodone, and they're buying them on the streets. And the problem with that is that they're laced with fentanyl. There's way too many mothers that I've spoken to that have spoken about their son being dead, finding their son dead, finding their daughter dead. One thing was we give out Narcan all the time, everywhere we go, and we were able to give out Narcan at a dinner, to find out a year later that one of the men that went to that dinner was watching a football game with his son, and his son went to the bathroom and he didn't come back out. So he went to check on his son and he found his son overdosed on the floor. When he remembered that he had that Narcan that he got at the dinner in a junk drawer, came back, administered the Narcan, and was able to save his own son's life. Please be careful when it comes to these pills. Please understand that at an average, 8 out of 10 pills that are bought on the street through any number of social media accounts, whether it's Snapchat or Instagram or whatever other social media outlet there is, a lot of these pills are being laced with fentanyl. And it's terrifying to have young people lose their lives because they don't know what they're taking. School starting, please be careful, look out for your friends. If you need Narcan, please call us here at the spot. Our number is 954-566-SPOT, or you could look us up on Facebook or Instagram, and we're thespot.org. Or the Spot Broward is our tagline. But please be careful. Tell your friends to be careful if they're ingesting anything, any kind of pill that they don't know where it came from. Please be cautious and understand that there can be fentanyl in those pills and they might lose their life. It's not anymore about getting a little high on a Molly or an ecstasy. It's about whether I'm going to die if I take that Molly or ecstasy. Narcan is a life-saving medication. It's naloxone, which is an opioid overdose antidote, and it's an easy use. It's a simple one step. Well, it's got a few steps, but it's easy enough to use. And all you have to do is put it in someone's nose and push the button. There's no side effects to this. The instructions come in the package, and all you have to do is put it up somebody's nose and push the button. It's an easy thing to do. I have saved 9 lives or reversed 9 overdoses, and I hope none of you ever have to use this. But you could simply save a life with this little thing, and all you have to do is push the little red button. It's a one-time use, but again, remember there's no side effects. The only side effect this medication has is life. And I know it to have been used on elderly patients. I know it to have been used on an 18-month-old child. So please just make sure that you try your best. If you know anyone who is using medications that are not prescribed to them, have them get Narcan, or you get Narcan, because any one of you can save a life. Again, any one of you can save a life. Just call. You can call us, or you could just Google how to get Narcan, and you'll be able to find vast locations where you can find them. Hopefully you'll be able to find them close to you. And if not, contact us and we'll get them to you somehow. It's all about getting every single one of you to have some Narcan with you so that you could save a life and hopefully never have to use it. I really hope none of you ever have to use it. Thank you.
Thank you, Amelia. We're so fortunate to have the Spot service throughout Broward County, and we thank you for your leadership across your career. We know you've touched countless lives. Our next presenter today is Outreach Coordinator for Oxford House in the Miami area, Andrew Ward. Andrew started his journey in Louisiana, where he helped open an Oxford House as a member in 2018, and fell in love with the service structure of Oxford House. He now works for Oxford House full-time as it opened houses across 6 counties in Florida, and he is certified as a recovery peer specialist and certified event interventionist. Andrew, thank you so much for joining us today.
My name is Andrew Ward. I'm an outreach worker for Oxford House, and we are a national recovery residence organization. We've been around in the country since 1975. We've been in the state of Florida since 2019. And as of right now, in the state of Florida, we have 217 houses, 1,959 beds. And in Miami, we have 4 houses with 43 beds, and that includes 3 men's houses and 1 women and children's house. And so a little bit about Oxford House is that Oxford House Inc. grants each individual Oxford House a charter, and they must abide by 3 simple rules, and that is the Oxford House must be run democratically, the house must be financially self-supporting, and the house must expel all members who relapse. And each house, since it is run democratically, it must have a meeting once a week that is ran completely by the members themselves. It's set up kind of like a board. There's a president, a secretary, a treasurer, a comptroller, a chore coordinator, and every week they sit around and they have a meeting where they discuss the finances of the house. They discuss any conflicts arising, they discuss their personal growth and recovery and see how they can support one another in obtaining better recovery. One of the things that Oxford House really focuses on is not putting out members to make room for another member, so that you can stay as in Oxford House as long as you like. There's no time limit, and that the reason is we don't want to ask somebody to leave that's doing good in their recovery to make room for a new person. If a house fills up, then we will just expand our number of houses and we will open a new house. And the reason for that is we want people to be comfortable in their sobriety. And whenever they leave Oxford House, they'll have a foundation that they can stay sober for the rest of their life. Being comfortable in sobriety is one of Oxford House's key to success. And I've been in Oxford House since 2018. I first started in Oxford House in Louisiana as a member, and I lived in Oxford House for a year in Louisiana, where I actually opened a house as a member there. I served on the chapter and the housing services committee level there, as chapter chair and as other type of service positions. And then I was hired to go work in Florida as an outreach worker. And so Oxford House is a huge part of my success in recovery. And the one thing that I know that Oxford House does very well is the peer-to-peer support inside of the houses. And so I know whenever I leave my job or wherever I am that day and I have to go home to my Oxford House, no matter what, if I had a bad day or if I had anything, whenever I get back inside my Oxford House, I know that I'm safe and I'm going to have people that I can talk to and I can lean on and that I can express my feelings to and help grow in my recovery. If you would like to put in an application for Oxford House, you can go to oxfordvacancies.com. That is a national website for Oxford House where you can look up vacancies all across the nation and each state and every county, and it'll tell you real-time vacancies for those areas. And you can also go to oxfordhousefl.org, which is Florida's state Oxford House website. That will give you information about Oxford houses in Florida. And it'll also give you ways to support Oxford houses in Florida. So if you would like to support Oxford houses in Florida, I urge you to go to www.oxfordhousefl.org.
Thank you, Andrew. Your work is so important in giving people security and stability when they need it most. And we know that each Oxford House is a crucial player in the lives of so many residents each year. We're wishing you continued success and appreciate your partnership. I would once again like to thank each of our speakers today. They are doing so much to raise awareness and expand services in this challenging environment. And now we will view the overdose prevention simulation portion of the event. Walmart has invested in virtual reality equipment training facilities for their associates to build skills in unique situations that are hard to replicate in a classroom setting, like front-of-store shopping experiences and emergency preparedness simulations. This technology has led to the development of non-retail training, such as VR, which we will see next. Let's take a moment to view this training.
Guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of Naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, Make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We're so excited to work with you and to connect this resource with the community. In closing, we'd like to extend our full thanks of all the speakers and participants for attending this event. We truly appreciate your time and insight. Thank you so much to all of you for supporting Gang Alternative and the Urban Partnership Drug-Free Community Coalition. It's only through your support that we can offer all the services and touch the number of lives that we do in the community. And finally, I'd like to thank our friends at CADCA, Mia Wallace, and the development and management team at CADCA. Please reach out to them to learn how you can be more involved in this work and for additional training. This now concludes our webinar. I wish you a great rest of the week. Thank you.